Okay. Aloha mai kako, everyone. Thank you for joining us. My name is Kivale Kadina, and I will be the moderator and facilitator of today's webinar. We're here to talk about telehealth. Who? Tele-What? Telehealth. So telehealth is something that is really coming to the forefront of healthcare, and especially in a lot of Native communities where we see more rural areas. This can be a really beneficial piece to bringing quality and essential healthcare to people in need. So this is a great place to have this discussion. Um, with me, we have a few presenters, and I'll get to introducing them shortly. However, I wanted to tell you a little bit about the National Native HIV Network, if you don't already know. We are a network of folks from all over the United States of America, including Alaska and Hawaii. We represent Native communities in all of the regions of our country, and all of us are connected to HIV services in some ways. Many of us are parts of community-based organizations, healthcare providers, community advocates, and the list goes on. And so the Native Network is doing its best to keep Native people at the forefront of HIV services and care by providing these types of webinars and our newsletters. So if you want to learn more about who we are and what we do, you can log into our Facebook, National Native HIV Network, and sign up for our newsletter, and then you'll find out about all of the other different webinars and educational pieces that we have going. This is going to be an intimate group, and so we will make some time for you folks to ask questions to our presenters in between each presentation from our two different presenters, and we'll also have some time at the end if more questions arise. I will be monitoring the chat box during these presentations, so don't feel if your question doesn't get answered that it's being ignored. I'm going to be writing it on the side so that we can address it at the end. A little bit about myself. My name is Kivale Kadina. I'm the Director of Harm Reduction Services at Kumukani Health and Wellness on the Big Island of Hawaii. We call it Hawaii Island. We have two offices that serve the east and west side of the island, which is about 4,000 square miles of landscape. So two offices to serve a really large area, and a lot of Native communities know what that's like. And so we're an organization that is primarily serving people around HIV services, case management, education, prevention, testing, and we've adapted and expanded to really look at the social determinants of things that keep people at risk of exposure to HIV, but also educating community to really destigmatize the virus. And so I would like to introduce you folks to a few of our, sorry, I apologize for the noise. I'm actually in the airport. But I wanted to introduce you folks to our attendees, and I just lost my bio sheet. Give me 1 second here. Give me 1 second here. Yikes, I'm so sorry, folks. Well, I'll tell you what, I don't want to waste time on our webinar here, so I am going to allow them to introduce themselves. First, we have Kunani Dreyer. He is the Director of Training Services at Hawaii Health and Harm Reduction Center, and I'll allow him to tell you a little about himself, and he's going to share his presentation about what they're doing at Hawaii Health and Harm Reduction Center to address telehealth. So Kunani, it's all yours. Take it away.
I think we're going to have Lorelai go first, Kiva, just because of time. We'll switch it up just
Excuse me, I apologize, you're right. Lorelai is from Alaska, and I'm going to let her tell you all about herself because in front of me. Lorelai, it's all yours. Take it away.
Hey, everybody. Good morning. My name is Lorelai Riley, and I'm the Senior Program Manager for the Early Intervention Services Department at the Alaska Native Tribal Health Consortium in the beautiful but fuzzy background of Anchorage, Alaska. had quite a bit of a rainy summer, so we're wishing love to our sister states in Hawaii and saying bring us some of that sun, but we're okay for now. A large part of my job that I do here is kind of day-to-day operations for our Ryan White Part C funded HIV clinic. We're one of two Ryan White Part C funded HIV clinics here in Anchorage and in the state of Alaska, and we're the only Ryan White Part C clinic in the nation that serves strictly Indigenous based populations. So we have a sister organization here in Anchorage that really kind of takes care of a lot of Anchorage based sort of community needs. And then our program has a large statewide sort of perspective and then an Indigenous focus as well. I've been the senior program manager of this program for over 7 years, and I've been with ANTHC for over 10. The first couple of years in my career here in Alaska were actually to do process design for specialty care VTC, which is video technology services or centers for video follow-ups for the great state of Alaska. So I've got a little bit of subject matter expertise on how we do this in Alaska and have some really great process information on how you can really get the conversation started in your own organizations. So I think we all know that change can be difficult without some sort of steps to really kind of map out where we want to go. So I am ready to share some slides if everybody's ready for that. Are we ready? I think we're ready to go. Let me go ahead and put mine on presentation mode, everyone. And we'll share everything that we can about Alaska for you. Just to give everybody a little bit of an update, since I do have to run out and leave a little bit early, we have a consumer advisory board lunch today. So my contact information, I'm going to go ahead and put it in the chat. Please feel free to email me with any questions or any information sort of that I can share since I do have to leave the session a little bit early. All right, let's go ahead and share the screen. Da, 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 da. There we go. Okay. Can everybody see my screen? Can I just get a thumbs up from anybody on?
We can see your screen.
Oh, wonderful. Okay, so we're going to go ahead and get started. Everybody, wonderful. Welcome to Telemedicine in Alaska. We have actually had a large substantiated telemedicine program set up in Alaska since the early 2000s, actually in 2002. So we're going to start from the grassroots to where we are now. So we are providing medical care kind of without those boundaries in a very large area that covers many, many, many miles. So let's start with a brief background about the Alaska Native Health System. It's a voluntary affiliation with 30 Alaskan tribes and tribal organizations providing healthcare services to Alaska Natives and American Indians. And we have about 7,000, probably about 10,000 now, employees across the state. So each is autonomous and serves a specific geographical area. So that in itself creates a little bit of problems with coordination and care for referral services for patients. So if we're all acting independently, sometimes some coordination efforts need to be streamlined so we can provide succinct care, okay? So the Alaska Native Medical Center is located here in Anchorage. It's jointly managed with a South Central Foundation, which provides primary care service delivery. We're here at Alaska Native Medical Center. We have the large tertiary hospital and specialty care services. So since Alaska is so big and so broad, we only have a couple of urban centers that can really have specialty care options. We are one of those options sitting here in Anchorage, okay? So here are the levels of that medical service, again, providing you this information so that everyone knows how this information actually comes together and how we actually refer care to clients and patients living throughout the state, okay? So we have 6 regional hospitals, 4 multi-physician health centers, 25 sub-regional mid-level care centers in the state, and 180 small community primary care centers, which are called village clinics. So I love this graph, okay? A lot of times pictures speak louder than words. A lot of times when we see tiny infographics of Alaska, they're kind of off pushed to the corner, and we may not understand how vastly large Alaska really is. But this graphic is overlaid on the lower 48 states, and this is how big and broad the territory is that not only we serve with our department, but that other specialty care services serve throughout the state, and the location of those sub-regional hospitals. So all of these lines that you see is actually the referral process mapping for how information and patients can get the most advanced care while they are in their rural setting. Okay. It's also worth noting that Alaska really doesn't have availability in terms of paved roads. We only have under 1,000 miles of paved road access in the state. So most coordination for medical care is happening by small plane. It's happening by snow machine, and it's happening by four-wheelers. We are using these ancillary forms of transportation to get to where we need to go because that's what we have to work with. Boats, all of these things. So telemedicine, again, has been on the forefront of healthcare delivery for as soon as we actually knew that this was an option because of these barriers to care. So village-based medical services, really kind of important that everybody has an understanding of how this works because these individuals who are serving some of our most rural clients and patients are such inspirations for new process development and how to deliver the best healthcare that we possibly can. Okay. We have the 180 small village healthcare centers employing 550 community healthcare aides that are individuals that are brought up from their home community and put through medical training to be able to serve their community. We have 125 behavioral health aides to be able to address that behavioral health care disparity in the state. We have 20 dental health aides with 20 dental therapists that can also go out and see people virtually and in person. And we have 100 home health and personal attendants. This program is incredibly wonderful. And if anybody would like information about the community health aid program and the behavioral health aid program, I would be more than happy to share that as well. So what are some examples of telemedicine technologies that Alaska has been able to successfully deploy in our state for the last 20 years? One is to understand the different terms on how we utilize the technology. First is store and forward. What we do is we capture information, we put it into like a digital case that we would like with our EHRs, and then we forward that to a specialist so that they can review and actually make a formal referral or give that practitioner in that home village a care plan for treatments. And then we have live video delivery, okay, which specialty care providers can team up with those village level providers and coordinate a visit to a home location so that patient doesn't have to travel in from home and spend probably a week in Anchorage going through specialty care appointments to get their treatment plans updated. Okay. Going back to store and forward, just really quickly, this device has changed the landscape for Alaska in one of the most beneficial ways in healthcare delivery in the last 30 years. This is called a telemedicine cart. I know a lot of individuals have seen this, but if you haven't, here it is. These machines were deployed out to every community that had a village clinic with a village health aide so that we could do some store and forward technology practices and capture primary care information and be able to forward that on to practitioners and specialists that are either at the sub-regional hospital level or here at the specialty level here in Anchorage. Okay. So a couple of things that this cart can actually do is ENT. It can do a lot of heart disease with the ECG monitors and the vital signs monitors. It really can help out with respiratory illness diagnosis, trauma and skin wounds. This device is really used for a lot of its video capturing for dermatology, dental sorts of problems, and then general form questions are also embedded into this cart if there's not a peripheral tool that can actually address the problem. So how this actually works is a case is originated in one of the village level clinic sites, and we use the peripheral devices that are embedded into the cart, and it captures it into a digital case that we can then forward to a provider that they can review and then consult with the provider at home. It's pretty cool. So how to create a telemedicine visit in an electronic healthcare record. I put this slide in for a couple of important reasons that I'll talk about right now. It's not only having the technologies for telemedicine that makes them successful. It's about developing a process and a plan for the individuals that have to really implement these technologies that fit into already existing processes that make it really successful. I know that some of the challenges that a lot of programs and a lot of clinics have had over the years about implementing telemedicine is it just feels like too big of an animal to insert into an already working sort of clinic flow. We have to design our processes to reflect a new service in an existing service. So I have a lot of process mapping on how to make your EHR work in terms of flexibility and then accuracy when we're scheduling video visit follow-ups. We use Cerner here in Anchorage, okay? But not all of the healthcare centers that we work with for the people that we serve are on the same EHRs. So we work with those sub-regional hospitals to be able to identify ways in their EHR that they can identify if somebody's having a video visit and how we can chart that appropriately inside of the case. So roles of telemedicine here in Alaska. Store and forward, 3% of the encounters take up 75% of primary care. That's incredible. So most store and forward cases are going to primary care physicians that can really look at that information that has been stored and forwarded onto them, and they can provide either referrals or case consultation in real time for primary care issues. Specialty care uses store and forward up to about 25%. We really see more video teleconferencing on the specialty care side, so we can have that team coordination at the village clinic with the village clinic provider, and then also with the patient in real time. Store and forward is also really great for triage and planning. It's also really wonderful for discharge planning. And video teleconferencing is so fabulous for all of our specialty care services, so we can have that real-time narration and come up with follow-up care plans as a team. Telemedicine expansion. So this is kind of what's on the docket for ANTHC, for the Alaska Native Tribal Health Consortium, to see how we can expand our already existing services for telemedicine. So I'll let you guys go ahead and take a look at this slide. I know it's a little mumbly and jumbly, and it's got a little bit of the tech words in it as well. But really what we want to be able to do is make telemedicine an available resource for anybody who is providing care services for our Indigenous-based populations around the state. We want to make sure that we can remove the barriers by developing processes for every single specialty service, every single behavioral health service, and for primary care services to be able to coordinate with village clinics, sub-regional hospitals, and with patients in their home community to provide them the service so that we can keep them at home and provide them the health care there. This is probably my favorite slide in the world, okay? As a process person, right here, a good swim lane diagram gives me a visual representation of realistically, what are the steps that need to take for a video visit to actually take place? And by mapping out these steps, by putting it side to side with the literal steps that have to take place for a client to be able to get services in person in our clinic, they should be able to match. They should be very close to being mirrored, okay? So again, if you're really looking at implementing some telemedicine processes and technologies into your services, into your programs, into your clinic, process design should be the first step before we even start looking at telemedicine available technologies, right? We want to make sure that we can actually absorb in a new service into an existing process that makes sense, not only for the people that we serve, but for the people that we work with as well. Okay, and I can provide all of this wonderful stuff if anybody's interested. Examples of telemedicine topics, especially for us here at the HIV clinic, we discuss drug interactions. Adherence barriers is the big one, especially if we can do a video visit with the village practitioner as well, so we can discuss how we can eliminate some of those barriers at home. Okay, we can discuss viral resistance. We can discuss all antiretroviral therapies, medication reconciliation, counseling, adherence. We can have our case managers on as well with the providers, which provides that additional engagement and care piece, especially for the people that we serve, okay? Oh, I know this is wordy, and I'm so sorry, guys. I wanted to send this out to you guys as a flyer, so I'm just going to leave this up and talk through it just a little bit, okay? Pros and cons that we have seen over the many years for providing telemedicine services. Healthcare costs and patient travel costs. I know that it feels kind of like an unnecessary thing to talk about when it was like How do we provide the best care? But by being able to save some money, and especially for some Medicaid travel money, we're able to provide a higher level of care. And it actually helps the clients out as well when we find out that this is a really good option for them if they are working, especially working families with children. They may not have the time availability to take 3 and 4 days off from work that it would take to get from their home community all the way to here in Anchorage to be able to have all their appointments at the one time and then fly home. That may not be the best plan for that individual. So by being able to provide extra options saves people not only time and money, but provides kind of quality of life measures as well. Okay. It extends specialist and referring physician access. I have to tell you, this is the big one. This is the big one, especially up here in the state of Alaska. We do not have a lot of specialists that are just kind of sprinkled around the state. They are more in our urban centers, especially here in Anchorage, maybe a few in Fairbanks, and then some in the southeast areas of Lake Juneau and Sitka. But again, you're looking at that most of your specialty care services are retained here at ANTHC, so the Alaska Native Tribal Health Consortium over here in the urban center of Anchorage. So by being able to provide these telemedicine solutions, we're expanding access. We're expanding the availability for people to be able to have high level of treatment while they stay at home. Increase patient engagement, especially for us in our program. So when people live as far as 2,000 miles away from you, this is a really great opportunity to be able to stay engaged with your clients when we can't physically see them as much as we would like to. Here in our program, our providers go out to a lot of these rural communities to meet people where they are and provide those services. But for the in-between times, when people do need some attention and they really need some consultation, we have this as an available service, and it has been wonderful for patient engagement with us. Okay. Some lessons learned, big time. Okay. Telemedicine should be easy, and it needs to fit in existing clinical workflows like we've kind of been talking about all morning. Coordination of these visits can be very complex. Boy, they shouldn't be though. And they can and may include many roles from multiple sites. So again, starting your project with process development, in my opinion, is very key. Okay. Identifying all the roles that it will take to make sure that we can get this visit complete. And then what do we do after the visit's completed? What are the role assignments there? Okay. Telemedicine technologies don't have to be that complex to be effective. Alaska provides telemedicine visits by webcams and headsets supported by Zoom software. I do want to say that we do have the HIPAA compliant clinical Zoom accounts that are now embedded into our EHR. So we can actually launch a video visit right from the client's chart. Pretty cool. Okay, to get a closer look really about what's happening here, I've put down some links. I will again put those in the chat and make sure that we have those for our moderating staff. Those YouTube videos are wonderful to be able to see the Alaskan landscape in real time and how these technologies work in real time as well. Wanted to ask and see if anybody had any questions. I know I ran through that super quickly, so thank you for everybody's time and attention to this. Wanted to send a couple of beautiful pictures, not only of our staff, but of a couple really beautiful places in Alaska that we've been able to capture, and really leave this time open for you guys to ask me about any sort of process questions, any development questions, or technology questions as well. And if there's no questions, thank you guys so much for being on and doing what you do.
Lorelai, thank you so much. I don't see any questions in the chat box. But such good information. Really appreciated the advisement on what can be offered through telemedicine, looking outside into early intervention services, and talking about medications and huge variety of things that can be discussed.
And kind of running back and talking to your consumers as well about their experience. Like I said, we're going to run out and go to our consumer advisory board meeting, and we're going to be talking about some of the service delivery and being like, hey, is this really working for you? This was something that we were able to really not only expand on, but capitalize on during COVID. Right. So having that traction and having these processes already built out just meant that we could plug and play and keep people safe at home. And what a gift that was. So we're going to be getting a lot of feedback even from our consumers today about what experience that really was for them, especially for the last 2 years. So I'll put my information in the chat. Everyone, I welcome any sort of questions, any other comments. Please email me. That's the best way to get in touch with me.
Thank you. Lorelai, if you could, I think Kurt has his hand up.
Hey, Lorelai, great presentation. I love the fact that you're able to conduct a Zoom visit with a patient right from their EHR, from their chart. And I think that would just save so much time for me. And I'm thinking here in the lower 48 with because as you know, some reservations are distance-based as well. And so having to get patients to their provider can take upwards of 4 hours just to drive across state. So what has been like the feedback and response from patients to being able to have that quick accessibility from their chart directly?
Wonderful question, Kurt. And I'll go ahead and answer this with a multi-pronged answer like I usually do. So technology for almost anybody in this world can be a barrier if we don't prepare people for the experience, right? So here in Alaska and like in most rural states, boy, the Wi-Fi ain't great. Okay, so testing a lot of these processes, even with the client before their scheduled appointment, man, that has been a huge lifesaver, especially if we're doing a direct video to a client's home, which is exactly what we were doing during COVID. Now, most of our video services are connected to either a village health clinic or a sub-regional hospital. So the client would actually go into the clinic or into the sub-regional hospital and be with their village health aide or their sub-regional primary care physician and having that joint video call with a specialist over here at A&MC. Okay. However, we do still provide a lot of at-home sort of check-ins. So having it embedded into the chart is a wonderful ease for the provider. Okay, so there isn't a whole lot of technology to learn about. I will definitely share some job aids, how we were able to embed that into our EHR without a whole lot of money, because we all know when we start messing with our EHRs, it costs money because there are new developments, there are new plugins, all of that stuff. So I have plans for that if people are interested. So that was a wonderful thing on the provider level. So they could be in the chart, review what they needed to review, and launch right from there. The trouble has been on the receiving end. So being able to practice with patients ahead of time and make sure that their phones can connect, make sure that they know how to access their Zoom link, make sure they know how to adjust their settings on their phone has been key. And then also if we're doing any video technologies to village healthcare centers or to even sub-regional hospitals, testing with those locations, even a couple of hours before the VTC has been life-saving because Wi-Fi goes out in Alaska, and I know it does in Hawaii too, and I know it does in the lower 48, especially in the rural regions. So sometimes knowing that ahead of time, we can move through a little bit of a triage process and maybe even pick up the phone. Okay, so if the client is there and we can't get hooked up by Wi-Fi, it is not a completely wasted amount of everyone's time. We can still kind of satisfy what needs to happen with a patient. We can pick up the phone and do what we can and make sure that we can move forward. So we've got some plans for what happens when things don't work out, which is another sort of development process, and process development I think is really important for anybody developing a new telemedicine service or a new service delivery. Anyway. Like what can go wrong will go wrong. Did that answer your question, Kurt? Kind of, sort of?
It did, yeah. Thank you for that. I love the fact that that there is like some uptake processing there in terms of really being able to practice with the patient. Because yes, especially I'm thinking like with elders and people in like really remote areas where you're right, Wi-Fi is maybe strong one moment and then the winds will come in and then knock that reception out the window. And then now you have, and I like the idea that yeah, you just come back and resort to a phone call. Just call and say, hey, let's chat. Because I know that for myself, I do telemed with my provider who is in another state. And so we just do via phone call. And so that's worked wonderfully. And I only need to go in to see her maybe once or twice a year. So that's been a savior for me, especially traveling across the country quite a bit. So I just think that this is very beneficial for patients there. So definitely would love to see more information and see how we can collaborate with ANTHC to bring that type of technology and processing to other healthcare facilities here in the lower 48.
I'm down, Kurt, and I have the capacity for all of that sort of collaboration. We have an entire telemedicine department here in THC, so we're very fortunate to have that. And we have a lot of lessons learned that we'd like to share with people so they can just kind of take that success and sort of plug and play. So anything that you're thinking, Kurt, please reach out to me. And I'm going to go ahead and throw my email in the chat. And if we don't have any other questions, I'm going to go run and have a meeting with our consumers.
Awesome. Thank you, Lorelai.
Thank you,
Thanks, everybody,
Lorelai.
for being here and doing everything that you do. It's wonderful to see such engagement for our people living out in some rural areas. So,
Likewise,
everybody.
likewise. Thank you so much.
throw in the email in the chat. Bye, everyone.
Aloha. I think it's so perfect that right now she's on her way to a consumer advisory meeting to check in with patients and clients about telemedicine. So how perfect is that? It's a great example of making sure that nothing is being done without the community's input. So great work being done over at ATHC. I'd like to move on to our next presenter. Kunani Dreyer is the Director of Training and Program Development at the Hawaii Health and Harm Reduction Center. Kunani Dreyer is a leader within the LGBTQI community. Kunani has worked in the field for 19 plus years, providing HIV and Hep C testing and prevention services, smoking cessation, and most recently working with individuals experiencing houselessness. Kunani also provides capacity building and training with a focus on harm reduction throughout Hawaii and the United States affiliated Pacific Islands. Punani is a graduate of the University of Hawaii at West Oahu with a bachelor's in public administration. Punani is a recipient of the Pacific Business News 2019 Business of Pride Award, and he continues to build and foster community relationships in both his professional and personal life. Please welcome from Hawaii Health and Harm Reduction Center to present on telemedicine in Hawaii, Director of Training Program Development, Kunani Dreyer. Oh, that was a mouthful. Good job.
I was gonna say, I love how we just got so formal all of a sudden in our little informal setting. And I'm excited that this is being recorded, because what I do know, if anybody's like me, we're busy, and I will listen to a webinar or a event like this at home when I have some downtime so I can get the information. So aloha everyone, Kunani Dreyer, and I'm here in Honolulu at the Hawaii Health and Harm Reduction Center. And let me share my slides really quickly so we can get all of this recorded and included. Okay, and then I'm going to go here and I'm going to say slideshow. Are you folks seeing the slides or the presenter view, Kiva?
We don't see the slides yet, Kunani.
How about now?
No slides.
Okay, we're going to try this again. Oh, here, share.
There we go.
And are you
Now
seeing?
that's, I have the
slideshow?
presenter's view.
Okay, let me get there. How do I switch it?
Click the yeah, the slideshow button from the beginning, because we can see the
Okay, there.
there we
There
go.
we go.
There we go.
Slides or presenter.
You have the slides now. You're set to go.
Okay. All right. So Tele-What, right? Extending our reach, services, and support. And just as Lorelai shared, you know, we've been doing telehealth, whatever you want to call it now for a while. What I get to talk about today is this really neat and innovative partnership and project that we were asked to be part of to really extend our reach in services and support to the community, especially community individuals, patients that may not be able to come to our actual site, may not have the capacity or the technology in their hands to access telehealth. And so this is a really neat project. And before I move on, I wanted to acknowledge, I saw Keani Valdez in the participant list for today, part of this project and part of the team that's kind of leading all of this. So I wanted to make sure I took a moment for that. So really quickly, Hawaii Health and Harm Reduction Center, this is our mission statement. It's awfully long: reducing harm, promoting health, creating wellness, and fighting stigma in Hawaii and the Pacific. And as Kiva said, we have done, and we continue to do work within the 6 Pacific jurisdictions. And so that's partly why it's there. And primarily our work is done on Oahu, but we do provide services statewide in some areas. But I like to say that our agency works a lot of times with the communities that service providers don't necessarily understand or know how to provide services, right? People living with HIV, hepatitis, drug use, the LGBTQ community, transgender community, things like communities from this background where I like to believe or want to believe that other service providers may not necessarily understand and know how. So that's where my heart is. So again, Hawaii Health and Harm Reduction Center, we're at the intersection of criminal justice, chronic disease, mental health, substance use, houselessness. And what we know is that someone's going to come through our doors or access our services with maybe coming in just for one specific service. However, we know that many times our people need and would benefit from support in many areas within their lives. So Tele-What, right? Tele-What. So, again, this is a project that I'm going to share about is this really innovative idea of how do we partner within the community to better provide access to our patients, our people, right? So I know this was talking about how telehealth with people living with HIV, but this is more than just people living with HIV. This project makes telehealth services available to people living with HIV, substance use, houselessness, all of these arenas that agencies that we do work in. So HHHRC can better provide service and access to our clients. Especially those who cannot come all the way to Honolulu to access services, who may be able to get to one of the pop-up locations where these services would be offered. But currently we provide telehealth services through our agency around medical case management, substance use, treatment, medical and behavior health clinical services, smoking cessation, and it can look a few different ways, right? It could be where our clients are at home and have the capabilities and the equipment and the capacity, right? Internet, an iPad, whatever that may look like, their cell phone, to jump onto a video call with a provider. It could be that they're with their worker, an outreach worker, and then that interaction or that appointment will happen. And so we do it, right? We also provide space. So if clients wanted to come here and need to access a telehealth appointment with a provider outside of HHHRC, they can. So there's all these different nuances of telehealth that's currently happening. But this partnership, and I'm going to go into right now, it really is in my eyes, a game changer. So let's talk a little bit about what this really looks like. So I'm going to start at the beginning, right? The Pacific Basin Telehealth Resource Center, right, is a program out of the University of Hawaii at Manoa, and the PBTRC is one of 14 federally funded telehealth resource centers in the United States. They primarily, just like us, serve Hawaii and the 6 Pacific jurisdictions, affiliated Pacific Islands, right? their mission is to advance telehealth by supporting healthcare providers, telehealth policy, workflow, and technology. And they're looking at digital equity. And that's such an important piece when we think about telehealth, right? It's easy for us to say we have telehealth, we can offer telehealth, but it's really, is there digital equity, as we heard in Alaska with the for rural, underserved, vulnerable populations, where we know it's not happening. We know it doesn't exist, right? I live in Hauula, which on Oahu is the northeast side of the island. It's very rural. Not everybody has access to telehealth or the capacity to do telehealth type services. And if they needed to get to our office, that's a whole hour and a half bus ride, that kind of thing, right? So it does become challenging for people to access in-person care. And so how do we bring telehealth to them? And this partnership with the PBTRC is the beginning of this. And they have already shown to make this work. They've created a program in partnership on Hawaii Island, which is also a big, huge island and very rural. And so this partnership they have going there is successful. And so that's a wonderful thing. So we already see it working, right? The efforts that the PBTRC is bringing to the table and bringing to the community. So again, here's kind of a little map of how their organization is all set up. PBTRC is Hawaii and the Pacific. So this project, this specific project, and this is what got me from the beginning, it was Telehealth Access Point project, right? TAPS. It's a joint, they started with the libraries, right? So the big question is, where and how can someone go and get access telehealth services when you don't have an iPad, when you don't have internet, when you don't have a computer at your home, and things like that. And so this project, the state library is saying, hey, come, we have space, we have the internet capacity, we can, let's try to set something up so that the people in our communities can come to the library and then be able to have engage in their telehealth appointments through this safe space, right? The safe space. And the funding is from CDC, and they're continue to work with different partners in the community. And I'm going to talk about our partners in a little while. But you know, the library provides that private room, connectivity, the equipment, and the wonderful thing is that there's funding to have somebody through the project kind of be the navigator or at this, you know, when somebody, I don't want to say, you know, the clinical person that they can check in with, the person's going to help get them set up in their space so that they can have their appointment, right? So they're in that space working. And then also digital literacy training. We heard Lorelei talk about that, right? You can't just hand somebody an iPad or a computer and say, okay, here's everything you need for your appointment. We'll see you in a week or something like that. But how do we teach our people, especially our kupuna, our elders, our people who have never used a laptop or don't have that experience? And so that's also part of what's coming through this project. So that's a wonderful thing. So again, here's another little slide about access, right? The design rooms or the pods, the bandwidth, maybe even mobile units. How do we do this, right? Patient health, navigation, education, training for the person who's going to be accessing the services, right? And workforce development and community engagement. Okay. And Kiani, I know you're on there, so you can, if I miss anything, please put it in the chat so that I make sure we highlight this project in the way it really should be. So who's at the table, right? A seat at the table. And you heard Lorelei talk about planning. I kind of got a little excited when I saw her little flow chart. I was like, maybe, you know, we need to do that within our own agency, and then maybe a little bigger one. Like, what does this really look like for everybody? Because we still have some unanswered questions or things that we're still planning out in this pre-implementation stage, right? So a seat at the table. So currently, right, we have our friends and our partners from PBTRC, who are the leads of this project and kind of gathering the players, right? Our agency, Hawaii Health and Harm Reduction Center, the State Library, Kukua Kalihi Valley is another partner who's been at the table. You know, the initial library that we're going to pilot this project out of is right there near Kukua Kalihi Valley, which is another service provider that provides medical, behavioral health, all of these different services to the community. And so this creates another option for their clients, their patients to come and access telehealth medicine without having to get to one of their locations, right? So there's benefit when we bring the more people we have at the table, you know, and if the library is giving the space for 5 days a week, how do we share the space with the other community partners in a way that we can maximize the benefits of having this available? And so, you know, we have specifically PBTRC is the capacity building and the resources and the guidance and the leadership in this project. Hawaii State Library, as I mentioned, is the space, the internet, the library staff. Look, the library staff is open to saying yes when someone walks in and says, I'm here for, you know, to do a telehealth medicine appointment. The library staff are going to say, well, this is where you need to go and point, you know, so they're open to having this, right? It has to be a full on, everybody wants to contribute to the process. Right? Kukua Kalihi Valley, they're all providing some training and capacity building, right? Some cultural humility around how to work with the clients that you're going to see from there. Because, you know, Kalihi Valley is a very, you know, is made up of very specific community, ethnic background and people. And so everybody involved needs to have this cultural humility. They're also coordinating some of the technology trainings and capacity building for our people. And then our agency, again, we're going to provide some training and capacity building because we know we're going to see possibly some of our houseless come in, right? And people who are living with HIV, people from our LGBT community. And we just want to make sure, and the library staff wants to make sure that they can best support, engage, interact with whoever may be coming through their doors. And so everybody's open and excited to have some of this capacity building around how do we work with, how do we engage with these various communities that will be accessing the services, right? And then, you know, we'll be providing clinical services through telehealth to our clients. But what this does is it opens this up for additional or new patients and new clients or people who may have never accessed the service, right, through an agency because they just couldn't get there. So we will see possibly new clients that are coming through the door that say, I want to access some services at Kalihi Valley or at Hawaii Health and Harm Reduction Center. And we're also talking about who's not at the table just yet. Who should we invite to the table to be part of this project? Sorry, I had to look at the chat. Oh, here's the other thing. I talk fast. So if you need me to slow down, just kind of put it in the chat and somebody will tell me, or you're welcome to ask questions anytime throughout this presentation since we're a little mellow today. Okay, so that was a big picture, right, of what's happening and how we all are going to play and work together around the table. So I want to talk a little bit about our discussions that we had at the table, really about what this could look like, right? What does the flow look like? And just keep in mind that we're still in this pre-implementation phase. We're still talking, we're still having discussions, we still have questions that need to be answered and figure out roles, responsibilities, that kind of thing. But right, so kind of what it would look like is our client, our person, our patient would we schedule an appointment for telemedicine. We're going to tell them, go to the library. And if you can't get to the library, do you need transportation? And then maybe it's an outreach worker or somebody who's going to get them to the library. They would go check in with the beautiful staff at the library, and say, I'm here. And then they would be given directions of where that private space is, right? And so this the Kalihi Palama Library, where our pilot project's going to be, they have a whole room, a separate room that we'll be able to, our clients will be able to come, our patients. You could have 2 or 3 different private spaces set up within that bigger, larger space. So they would check in at the TAPS team, right? The staff person that is being funded through the actual project would be there to help get them set up, put into their space, make sure they're able to get connected and have an understanding of what that looks like. And then they get connected to the provider that they're there to see, right? They're going to meet with their clinician. So this is the beautiful flow that we're anticipating will happen during someone's visit, right? And then again, when they're done with their appointment, do they need transportation back to wherever they came from? And these transportation services are being coordinated through the agency. So if they have an appointment with HHHRC and it's an HHHRC client, then we would be coordinating, how do we make sure our client is going to be able to get to the library on time? And then how do we make sure our patient gets back to where they need to go once their appointment is done? Everything that happens in between is happening within that space at the library. And so we don't necessarily need, we wouldn't necessarily have our navigator or outreach worker, kind of hovering over or being there, but really just to coordinate and support the client to get to this appointment. Yeah. Okay. So again, more about what we've been discussing to make this happen, right? Pre-implementation, planning meetings with all our partners, right? We're discussing our roles and responsibilities as a team, as a HUI, as a group to be successful within this project. And then we have to come back to our separate agencies, and within our agencies, what does that look like? What does this flow look like? What support do we need? That kind of thing, because although it's a project of multiple partners, we still have our own, the way that things function within the agency to be successful, right? What kind of training needs are needed for the partners with everyone? And then even what kind of training needs may we need within our own agency when it comes to making sure we have the capacity to do this and do this smoothly. We've been talking about a timeline of how we're going, to roll out this pilot project. We got to identify the practitioners, the services, the resources, what we're going to offer and able to offer, what Kokua Kalihi Valley is going to offer, what maybe other partners that come to the table offer. Because what's interesting about this is it's not specific. Our clients, our patients could then say, oh, there's a service at Kokua Kalihi Valley that would be beneficial, or that would be useful. So how do we then link them to these other services, right? It's not necessarily you're an HHHRC client, so you're going to access only our services, but how do we as a HUI, as a group, provide that linkage and so that people can maximize access to services. Yeah. And then we need to create design resource materials, and that could be about getting just the word out to the community. But even within like referral services, the library is going to need all the information because they're the first point of contact, right? Somebody walks through the doors, they might get asked questions. How do we make sure everybody throughout this program is trained in a way that they can hopefully answer questions, and if not, know where to go to look for the response or the answer, right? It's a lot of moving pieces, a lot of moving pieces. All right, so here, our responsibility, our kuleana, right? So those are on the continent. Kuleana means responsibility. So here's some of the things that we've already started to list out, or we've identified as next steps, or things that we need to do we and agreed to do, right? We're going to provide training to all the partners and people involved around Houselessness 101, LGBT cultural humility, harm reduction. People are going to do some shadowing and actually go out into the field with our outreach workers and our navigators. And that's Dr. Wang, the picture in that picture doing wound care right on the street. But, you know, these are some of the people who will be coming in to access the service. So people, you know, this is a way that people will get a better understanding of what services we provide, you know, who our community is that may be coming in to access the services, right? And then I put a couple pictures of our outreach teams, right? We need to identify the providers that are going to offer their services and what services are that. And then also, how do we really make sure that they're available at the time we start scheduling these appointments, right? We don't want somebody to walk in Friday at 2 o'clock and say, I'm here, I need to access some, you know, without an appointment, and we can't get in touch with the provider, or we don't want to overload our providers because now we're double booking and things like that. So how do we really plan out scheduling? How do we really plan out so that we don't overburden our providers, and we also don't create bumps in this process that it becomes a frustrating process. We want everybody to get the best and the maximum of this service, right? Our outreach and navigation teams, right? Their role in this is, right, maybe they're setting the appointment up for one of their own clients that's in the field that, you know, may be houseless and is going to have an appointment with one of our providers. But how do we make sure that person is able to get to that library, right? Is it the outreach worker who's going to go get them? Do we provide a bus pass? There's a lot of coordination outside of just let's call and make an appointment and then leave it up to them, right? So our outreach and navigation teams are going to have a role in the success of the client accessing the appointment, right? We have to come up with our own internal telemedicine workflow and our own internal P&Ps to make sure that this is a smooth process. And then some of our other questions we needing to answer, and I wrote this out, and some of them have been, we're getting responses, you know, internally we're working things out already, right? It's like, but who would be appropriate for this program or this service when we think of our clients and who we want to refer or say, you know, go to Kalihi Palama Library and they'll be able to, you know, we can do a telemedicine that way or something like that. So things like this we need to answer, right? Which programs would be appropriate and who would be the person or provider that would be doing it, right? Our HIV medical case management, houseless, you know, people in our houseless community, mental health, you know, and things like that. Can we, you know, we're talking about, can we enroll new clients to the agency right at that moment, right? Somebody versus getting them having to be here for that first initial appointment. And what does that look like? So we're in this process of answering these questions, yeah. And then how do we utilize this Kalihi Palama Library or this wherever they're accessing the telemedicine? But can we pull up our medical mobile unit so that we can do, you know, if they're coming in for this telemedicine appointment, can we have our medical mobile unit outside somehow so maybe they can get some STI screening or HIV testing or, you know, access to other services that we provide that you can't really do over telemedicine, that kind of thing. How do we really coordinate and get creative with all of this? And really maximize the potential of what this program brings to the community, to our communities, right? And then Lorelei talked about this too, the benefits, right? For us, HHHRC has an additional access point for services, right? Our rural areas, if their office is hard to get to, it really increases opportunity for client success within their treatment and just and whatever they may be doing and access to services, right? You know, if we're transporting people, we're holding people hostage, they're in our van for whatever time, we can engage with them on conversations and things like that to really offer support. And then linking additional services to the clients without the need to come to the office, right? Increase access to services, specialists, navigators, things like that, through telehealth, right? and I'm sure the list goes on. I was doing this at 5 a.m. So my brain stopped at that point. But I think the benefits for this, just and the partnership, right? Because the more people we have involved in this partnership, agencies, the players, right, the various libraries and everything, that we just start to increase the access for our people. And that's the main goal of this, right? So coming to you soon. And Kiani, I might be jumping the gun, but I was trying to think, when did we say we're going to try to pilot this? And we were thinking, I think September, October-ish. But there's a little picture of Kalihi Palama Public Library where our initial project is going to be. And I have to say, I'm really excited about this. And I think this would benefit our communities all together. And so I'm excited. And so I think we're gonna send this out, these slides, or they'll be made available somewhere, I think on the website. So all my contact information is here. So I'm gonna stop sharing. Did I stop sharing? I stopped the video. Stop sharing. And yes, so I don't know if Kiani is available and wants to say anything else. I don't want to put you on the spot. But yeah,
It's so
really
it's so exciting, Kunani, what you folks are doing.
yeah,
Oh.
I'm excited.
Hawaii Health and Harm Reduction Center continues to be the groundbreaking, forward-thinking piece to what the Pacific Islands need. A great example of how to provide modern and equitable services to the clients that we serve. So kalamai excuse me for the background noise. Kiani, you're welcome
Yes.
to the mic is yours.
Hello, thank you so much. And thank you, Kunane, for sharing about our collaboration together. And I'm just sending my mahalo from Christina as she is in Palau right now with our team and also advancing telehealth services there. But we are extremely excited about this opportunity for this pilot project. And stay tuned, everybody, for the rollout.
And Kiva, again, I just want to really give a big shout out to the PBTRC. I say that right? But they were the ones who this is their, like, they've been doing these little pilot projects around and reached out to us, and we saw the benefit of how this could really be supportive in the community. So it was almost like a no-brainer to say, yes, we want to participate. One last thing is really good. I think with telemedicine, telehealth, Tele-What, whatever you want to call it, is a partnership like this creates such a larger opportunity than just trying to set up telemedicine within your program by itself.
I'm wondering, I just kind of wanted to throw out a few questions to you, Kunani, and Kiani, please, you're welcome to chime in as well. As we said, this is recorded, so folks can go back and watch this later, and it's a great opportunity for people to hear other perspectives of folks that are involved in the work. And so I'm wondering how, aside from PrEP, how can telehealth appointments address HIV prevention? We heard earlier that we talked about early intervention services with the Alaska program, but I'm thinking of there's so much different new and innovative things coming out of HIV prevention, and so how can we incorporate HIV prevention into telehealth?
So,
Just off the
and Kiva,
cuff.
this is a great question, and when we think of telehealth, it can be utilized in any capacity. Like we use it with smoking cessation, we can use it with case management, right? So currently our clients, our HIV clients that are living with HIV, they're able to call, they're able to have telehealth appointments with their case manager, their medical case manager. We're already offering clinical telehealth appointments with our people, with the providers. But you bring up PrEP. And again, same thing, and we're envisioning all our within it's like we can do telehealth with the provider and, you know, our prep navigator, and then I'll just put in for the lab work to be done. So the client doesn't necessarily have to come here at all. They can do their appointment. They can then go down to the lab, DLS, which the good thing is DLS is all over the island. So again, it that takes out for the, you know, a barrier, and get what they need to be done so that our providers can write the prescription, right, for prep. Or same thing, they can do lab, clients can do lab work, and providers can then look and provide the telehealth services, the medical piece for HIV care through telehealth. And so it really removes the barrier of someone living in Waianae having to come all the way to Honolulu, right? Or someone who lives in Hauula having to come all the way to Honolulu, but can do all of this via telehealth and get everything they need done that way. And so it's breaking the walls down from traditional medicine. Yeah.
We one thing that we really noticed right away, so we only just initially within the last month began to see our prep patients for telehealth. We just began doing it, but one thing that we realized right away was that it also opens up your clinic schedule. So an appointment that may take 20 to 30 minutes in the clinic during telehealth is, you know, half of that is gone because the triage piece is gone with the time with the nurse and whatnot. And so it actually opens up the schedule for new consultations or other, like for us, we needed space for STI treatments. And so that has been a big help for us. The one thing that our provider really recommended when we were writing policies around telehealth for HIV prevention was that it would be an annual visit. So throughout the entire year, for the 3 months, they would do 3 telehealth appointments because of course it's every 3 to 4 months. So at least 3 telehealth appointments, and then they'd have to come in person just so the doctor can touch base and a face-to-face contact. And that's annually. So it is really helpful in rural areas. You know, Hawaii Island is much harder to get to get to our office. You know, it's an all-day trip for many people, especially if they don't have their own transportation. And so this has been a really great part. It's like a win-win for both sides. We're so jam-packed in our schedule and the clinic that now we can kind of alleviate that by seeing folks in telehealth, but also really helping people to have better access without feeling like their whole day is going to be one 30-minute appointment.
Yes, and the innovation of having a space, like whoever you can partner that has a private space with internet access can then also, you know, the library is not your traditional clinic space in any way, but yet that the thought of partnering with the libraries was so innovative, right? And just kind of on the forefront that it, you know, whoever your partner can be is going to be amazing.
That brings up a question that I'd love to ask both you and Kiani, if you're willing. When it comes to telehealth and using the library as a space, because that's a brilliant idea, how do we look at things like HIPAA and confidentiality when it comes to working alongside the library and are folks having to go in, that kind of thing? Like what kind of plans are you folks making to address the confidentiality and safety of the patients?
So so we're planning to do trainings with the library staff so that, you know, so they wouldn't necessarily they just know that they're coming for an appointment to access telehealth. They don't know why they're coming in, and none of that's being disclosed to them. And they're not going to be asking, right? Their primary role, one of their part is getting them to the space in the library that this is going to happen. And then there's going to be the navigator, the person who is kind of it's a paid position that's there through PBTRC, right? Through that will be able to say, okay, that has the schedule, the library has the schedule of who to expect. But then once they're in their space, it's all happening with the provider or the agency. So the HIPAA and all of that is all part of being built into the technology. And then, the EMR is still, and everything happens as if they were in your clinic. Yeah. But we're definitely planning for trainings around like confidentiality and that kind of stuff.
I love it. I think that it's really a huge way to address the houseless problem that we all experience on every island, and people feeling more empowered to be able to have agency over themselves, even if they lack housing and things like that. So I think that that's a great thing. We've heard so many times like housing is healthcare, and we're really working around that to build that bigger.
And Kiani, I can't remember. So there is a partnership with another group that does the technology literacy type training and things like that. There's also, and I believe Kiani, right, there's funding that would be able to provide somebody with a mobile hotspot and the other laptop or tablet or something like that. Like we've opted not to do that piece just because for reasons, but I did want to share, there's more involved, there's more opportunities and more aspects to what PBTRC can coordinate. But yeah, I didn't share too much about that at this point, but Kiani might be able to say more.
Yes. Yeah, that's correct. We do have funding to provide hotspots and Chromebooks for every single library location. And then probably not for this houseless community that we'll be lending them out to patients, but that is available. We did plan for that to be available. Yes.
I think we're going to have to come back to you folks for a 2.0 on this conversation so that we could see how the program is coming along.
I always enjoy those presentations that talk about bringing together public health plus our library systems, but also thinking about it further around what other non-traditional partnerships can we make. So within Navajo communities, each of our communities have a chapter house that's like the local governmental center. And, just thinking about those communities that don't have a clinic or a hospital, there's the potential for those chapter houses to serve as those telemedicine hubs so people can access the services that they might need. And so, just thinking about what are some of those other groups that we don't normally reach out to.
That's so interesting that you should say that, Savannah, because we've just recently collaborated with the county office because they have an empty space, an empty office in a rural town in the south part of the island, and it wasn't being used at all. Like it was basically storage, but it was this huge office space, and luckily, through a casual conversation with the county council member, we've been able to collaborate, and now we're providing a telemedicine hub, doing things like free testing, free treatments, and then we have a space so that our active clients can meet with their case manager. So I hadn't even thought about that. That is telemedicine, we're just taking it on the road and collaborating in really unexpected areas with, neighborhood boards and county council members.
Yeah, or tribal colleges as well. Some of the colleges might have degree programs for allied health professionals, and that could be an opportunity for them to get some training as well for those students that are in those programs. If you could offer like a telehealth site at those tribal colleges. So for like Navajo communities, we have 2 different colleges. One is Diné College, and they have satellite campuses across the Navajo Nation. And then there's also the Navajo Technical University. And so I'm just thinking about those satellite colleges being able to offer telemedicine in some way and giving on the job training for their students who might be interested in health professions.
One of the questions that I would have loved to ask Lorelei before she had to leave us was how can we ensure that mental health assessments are being met in those telehealth appointments? I think that's something that really has to be looked at and explored as well. I know that in-person assessment is really important piece of introducing a new patient or providing a consultation, really being able to assess that person's mental capacity and physical health. And so I really would love to have been able to ask that, and maybe someone else has has some input on what's being done around that area as well, like putting together that whole physical and mental assessment in a video setting. Does anyone else have any questions, any comments, any additions that they wanted to put into this conversation? I think that there's so much more to explore around telemedicine and telehealth visits. And it's nice to see that there's so many programs growing in Native communities and by Native people so that our folks are getting their needs met.
Eva, I see that Jennifer Arnold raised her hand.
Oh, there you are, Jen. Hi.
Hi. I just very briefly wanted to address our approach to mental health. Unfortunately, mental health has been a huge challenge, not only in Alaska, I certainly assume across the whole nation. So up here in Alaska, Lorelei very briefly touched on our community health aides that are out in our regions. As part of our outreach efforts, Alaska Native Tribal Health Consortium also works with training behavioral health aides that work within their regional hubs and do a lot of their outreach. So they are sort of self-managed within their own regions, but we do certainly help with some of the outreach on that and linkage to care if there's any need for that. Unfortunately, one of the big challenges that we've had across the state is, behavioral health and isolation. So getting to some of those more rural and smaller communities has been a big challenge. A part of our response team, or as a part of our response to that, we also have some crisis intervention groups and specialists here in Anchorage, especially around behavioral health that can go into rural communities, especially if there's sort of a large impact to the community that affects behavioral health. So often, some traumatic events and that sort of thing. So we do have some teams, not within, our program specifically, but we're very lucky with our tribal health system here in Alaska that there is a need that has been met with some of those emergency response teams. But a big challenge, of course, has been kind of ongoing and therapeutic behavioral health. So that's one of the things that might be more challenging to meet here in Alaska. But anyway, I just wanted to throw that out there as well.
Yeah, no, thank you. I think we all know in a lot of Native communities, mental health, it goes so far, so widely underdiagnosed, and we know so many of our participants and our clients that continue to engage with us with our community services, but still lack the provider to really kind of navigate them through mental health care. And so it's always going to be something that is important to talk about for our communities for sure. But Jen, so happy that you were able to join us and connect Lorelei to us. Really loved hearing her presentation. And as I said before, I always am excited about early intervention services. And so I had to really take a snapshot of all of the recommendations that she had for telehealth with EIS, because I really want to share that with our own provider in our organization at Kumukahi. And how we can really expand on early intervention types of services as well. So we're nearing the end of our presentation. If there are any last thoughts or questions or ideas for future discussions in these native webinars that is supported through the NNHN. Well, if not, I would like to thank Kunani Dreyer from Hawaii Health and Harm Reduction Center, Lorelei Riley from ANTHC, and Jennifer Arnold, and of course, our friends at CHIRP and with the Native HIV Network for providing this space to have these important conversations to help us grow and learn and share with each other so that we can all provide the best services to our communities. Mahalo everyone for joining us, and thank you so much. Until we meet again. Aloha no.